My name is David Fishman. I'm a clinical cardiologist at Community First Medical Center. When I trained at the University of Illinois, that was 1968, there was practically no treatment for patients having heart attacks. We put patients in quiet rooms with classical music on and made sure the air conditioner made them comfortable, and that was all we had. And now, patients who experience a heart attack, we have the capability as a practice at this hospital to take those patients immediately to an angiography suite and try to open up the artery, restore the blood flow, salvage the heart muscle, and restore the patient back to normal. And so the difference over the 40 years is that patients have gone from suffering permanent damage to their heart to being restored back to normal in a phenomenally brief period of time. I would tell patients, as well as their family members, not to overlook simple symptoms. We see many patients with advanced problems that can sometimes be fixed but would have been much easier and less complicated if the early warning signs of their illnesses had not been ignored. Shortness of breath in an inappropriate situation or chest pain ever is not normal. It's not a variation of normal, and it requires evaluation by a professional. I think the best part of the job is having an impact on someone's life when you don't know it. I gave a presentation last Friday at the Mather Senior Center, and there was a comfortable group, 15, 18 people, talking about their cardiac problems and healthy aging. And after the presentation, which was fun and interactive, a woman came up to me and said, "Thank you so much, Dr. Fishman." And I said, "Why?" And she said, "Well, you saved my life 30 years ago." And I looked at her and I didn't know who she was and have not seen her. And she said, "I've been well ever since that time when you diagnosed my heart problem." And I just went, "Oh," I said, "Thank you." and I drove home and I just felt, an undescribable euphoria, because sometimes when we take care of someone, we sometimes think, well, anybody could have done that if they'd been there. Any cardiologist would do that. But when a patient comes up unexpectedly and introduces himself and says, "Well, you saved my life 30 years ago and I've had a great time and been well since," that was really an experience. Those kinds of things are probably the most unexpected and joyous. My name is David Fishman. Thank you for your time.